Hi, my name is Maria Jose Gonzalez, and I'm going to talk about Clopidogrel with aspirin in acute minor stroke. First, I have to talk about acute minor stroke. A stroke is a condition in which the brain cells suddenly die because of a lack of oxygen. A stroke can be caused by obstruction of blood flow or the rupture of an artery that feeds the brain. The patient may suddenly lose the ability to speak. There may be the memory problems, or one side of the body can become paralyzed. There are some risk factors like age, being male, a female history of stroke, high blood pressure, high cholesterol, smoking cigarettes, diabetes, obesity and overweight, a previous stroke or transit, and high levels of homocysteine. What are the symptoms of stroke? Like trouble walking, loss of balance and coordination, speech problems, dizziness, numbness, weakness or paralysis, blur, blackness or double vision, sudden severe headache, and confusion. I have a video that shows what are the symptoms. We have to go. We have to go to the hospital if we see all of them.
Roper St. Francis Healthcare's House Calls TV.
Knowing the signs and symptoms of stroke can save your life. Dr. James Bumgardner explains why time is brain.
The best treatment, which is the clot-busting treatment, has to be given within 3 hours of onset of symptoms. If patients arrive in time, the strokes should be less severe, and that means less permanent disability to the people who are affected.
Call EMS if you have any of these signs or symptoms. Sudden severe headache, numbness or weakness of the face, arm or hand, usually on one side, dizziness, loss of coordination, trouble speaking or understanding speech, and for fast expert care, Roper Hospital is a primary stroke center.
About the treatment. People who are having stroke symptoms need to get to a hospital as quickly as possible. If the stroke is caused by a blood clot, a clot-busting drug may be given to dissolve the clot. Other treatments given in the hospital will depend on the cause of the stroke. These may include blood thinners such as heparin, warfarin, coumadin, aspirin, or clopidogrel. Medicine to control symptoms such as high blood pressure, special procedures or surgery to relieve symptoms or prevent more strokes, nutrients and fluids, feeding tube in the stomach. Here is going to talk a doctor about the different treatments in a stroke.
Hello, I'm Dr. Mark Alberts, head of the stroke program at Northwestern in Chicago. Welcome to this WebMD stroke update. Today I would like to update you about one of the studies, the results of which were presented at the International Stroke Conference in New Orleans in February of 2012. The long-running SPS-3 study results were announced after the study was stopped early by the DSMB. SPS-3 was a prospective randomized trial of patients with small subcortical strokes who were randomized to combination antiplatelet therapy, which was aspirin plus clopidogrel or aspirin alone. The DSMB stopped the study early for two reasons. Number one, there was evidence of more bleeding in the group that got aspirin plus clopidogrel compared to aspirin alone. And number two, based on a futility analysis, there was no evidence that the combination antiplatelet group did any better in terms of preventing subsequent stroke, MI, or vascular death than the monotherapy group. Now, there is another part of SPS-3 that's still ongoing, and that is intensive blood pressure lowering versus standard blood pressure lowering to see if that has any outcome on vascular events and dementia. And the results of that part of the study will not be known until perhaps later in the year.
One of the principles that we have here is the aspirin. The aspirin is an antiplatelet therapy helps prevent new clots from developing. Aspirin is the only antiplatelet agent that has been established as effective for the early treatment of acute ischemic stroke. The doctors may use yearly aspirin therapy for patients with ischemic stroke who are not receiving alteplase or anticoagulants. Here is a new that talks about the aspirin.
Hello, everybody. I'm Dr. Li Pingyu from Beijing Tiantan Hospital, Capital Medical University. And Beijing Tiantan Stroke Center is really the largest institute on neuroscience, especially on cerebrovascular disease. So we are taking the leading position in China either for the clinical practice and clinical research. Today, I'm going to give the presentation of the readout of the large RCT chance trial and one of the subgroup analysis of the intracranial artery stenosis. So everybody knows the ICAS by Astro is really common causes of stroke in China and higher burden of stroke in Chinese patients. So the how to treatment and how to management the risk factor is really significant. So the result from the subgroup analysis indicates the combination of the clopidogrel and aspirin treatment will be get a chance to better reduction of the recurrent stroke at 90 days.
About the clopidogrel is an antiplatelet medication that is also used in patients after a stroke to reduce the risk of having another stroke. In one trial, the combined risk of a stroke or vascular death was mostly reduced with clopidogrel treatment compared with aspirin treatment, and the result was statistically significant. We also have the pros and the contra about the combination of clopidogrel with aspirin. Pros: clopidogrel with aspirin reduces the risk of stroke in the 91st day. Other is that no increase the risk of hemorrhage. Aspirin and clopidogrel synergistically inhibit platelet aggregation, such as dual therapy, reduce the risk of recurrent ischemic events. But we have also the cons. The result of this trial can be generalized beyond 90 days after ischemic stroke, when the cumulative risk of bleeding with clopidogrel plus aspirin as compared with aspirin or clopidogrel alone offset the benefits. For most patients with ischemic stroke, the combined long-term use of aspirin and clopidogrel doesn't offer greater benefit for stroke prevention than either agent alone, but does substantially increase the risk of bleeding complications. Well, I found my exposition, and a doctor is going to talk about the combination of clopidogrel and aspirin, and is gonna say that is better using that for separated.
Hello, my name is Dr. Mark Alberts. I'm professor of neurology and head of the stroke program at Northwestern University in Chicago. This Medscape video blog update is going to focus on the ACTIVE-A study, which was a very important study for the prevention of stroke in patients with atrial fibrillation. This was reported at the recent American College of Cardiology meeting in Orlando and published online in the New England Journal of Medicine. What ACTIVATE did is that it took patients who were in atrial fibrillation with increased risk factors for stroke. A little bit more than 7,500 patients were randomized to receive either the combination of clopidogrel plus aspirin or aspirin alone. The dose of clopidogrel was 75 milligrams a day. The dose of aspirin was a low dose, 75 to 100 milligrams a day. This was a prospective, randomized, double-blind placebo trial. But again, all patients received either clopidogrel plus aspirin or aspirin alone. The primary endpoint was a combination of stroke, MI, or vascular death. And patients were followed a little bit longer than 4.5 years at the longest.